spinal fluid fills the ventricle and subarachnoid space. In humans, the volume of CSF is about 150 ml and the rate of CSF production is about 550 ml per day. The CSF turnover is about 3.7 times a day. The choroid plexus of lateral ventricle and also of third ventricle are the main sites of CSF formation. A small part of CSF is probably also formed by the brain parenchyma. The process of CSF formation includes both filtration and secretion. However, the CSF is not pure ultrafiltrate of the plasma. The cells of the choroid plexus also secrete in addition to filtration. The composition of lumbar CSF is essentially the same as that of brain ECF, extracellular fluid. That is nothing but the 15% of the brain volume that makes the 15% of the brain volume. The constituents of CSF are mainly the sodium, potassium, chloride, glucose, protein, and pH, and their concentration are given in the brackets. And the pH of CSF is around 7.3. If you see the circulation, the CSF thus formed comes out of the lateral ventricle. It enters into the third ventricle through foramen of Monro, then passes through the aqueduct of Sylvius to enter into the fourth ventricle. Then from there it escapes mainly through the foramen of Luschka and Magendie and occupies the subarachnoid space and is distributed all over the brain. A small part of CSF enters the central canal as well. Its absorption. At the sagittal sinus, finger-like projections called arachnoid villi are seen to project from the arachnoid matter. These arachnoid villi come in contact with the venous blood of sagittal sinus. The membranous structures which separates the CSF within the arachnoid villi and the venous blood of sagittal sinus consist of arachnoid matter plus meningeal layer of the dura mater. The epithelium of this membrane shows pores. When the pressure in the CSF, that is within the arachnoid villi, is high, the pores open up and the fluid escapes into venous blood. But the venous blood cannot enter villi because pressure within these sinuses are normally very low. If there is any rise in venous pressure within these sinuses, the pores will close down. Further, the colloidal osmotic tension of the venous blood of plasma is high. That is, it is because increased concentration of plasma proteins, whereas that in CSF, that is of the villi, is very low, which also aids in the transfer of CSF to the venous blood. As a part of CSF is absorbed via the arachnoid villi into the venous blood of the cranium and the spinal cord. So this is how the CSF is produced in the lateral ventricle and also in the third ventricle. It enters into the third ventricle, then into the fourth ventricle, and then from the fourth ventricle it will be reabsorbed from the Luschka and Magendie, and then it enters into the subarachnoid spaces. Then it is distributed all over the brain, okay, from where it is going to be absorbed into the sinuses like sagittal sinus. Functions of CSF. It forms a sort of a cushion around the brain. If the head receives any injury because of the presence of CSF, the impact of injury is distributed all over the brain, and thus no single area of brain has to bear a high degree of impact. If there is an edema of the brain as a result of brain injury or inflammation, the CSF escapes from the subarachnoid space into venous sinuses and thus provides some room so that brain is not pressurized. It may carry nutrients to the brain. Some of the applied aspects related to CSF are the lumbar puncture. In some diseases, it is necessary to examine CSF for diagnostic purposes. For this, a needle is passed between third and fourth lumbar spinous processes into the subarachnoid space within the vertebral canal. The spinal cord ends at the level of spinous processes of L1 or L2 vertebra. The other uses of lumbar puncture are it is used for diagnosis of meningitis, multiple sclerosis, and subarachnoid hemorrhage. Uh, it is used as therapeutic as well to administrate the antibiotics and anti-tumor drugs, and it is used to give anesthesia to administer spinal anesthesia. Abnormal CSF in cerebral arachnoid hemorrhage. In cerebral or subarachnoid hemorrhage, the CSF contains blood. In purulent meningitis, the CSF is cloudy, cell count is high, and consists of mainly neutrophils. Chemically, sugar concentration falls, protein concentration rises. All these features are due to the acute inflammation of the meninges. In viral encephalitis, the rise in the protein concentration may be the only abnormality. Hydrocephalus. The aqueduct of Sylvius may be constricted due to the certain forms of neurocephalus or tumor, and the CSF accumulates in the third and lateral ventricle but fails to appear from fourth ventricle onwards. As a result of the accumulation, intracranial tension rises, the brain matter is pressurized, leading to considerable damage to the brain. The foramen of Luschka and Magendie may be obliterated following inflammation to the meninges, leading to a similar conditions. Blood-brain barrier, the tight junctions between capillary endothelial cells in the brain and between epithelial cells in the choroid plexus effectively prevent proteins from entering the brain in adults and slows down the penetration of smaller molecules. For example, the slow penetration of urea. This uniquely limits the exchange of substances into the brain is referred as to a blood-brain barrier. Through the tight junctions, the endothelial cells of the brain capillaries, particles with molecular weight more than 2000 do not pass through. However, at some sites, the endothelial cells are covered by food process of astrocytes. This covering is, however, incomplete and large enough to permit substances with a molecular weight of 40,000. If any substance has to cross this wall, it has to penetrate the cell membrane of endothelial cells. So only lipid-soluble materials cross this barrier and others do not. The blood-brain barrier prevents the entry of many injurious substances to the brain, as the brain is more delicate and vital than